Nursing Assistant Army Exam Date 2025. Question 1. A client complains of chest pain. The nurse aide should: Option A. Give the client an aspirin. Option B. Have the client lie down and call the nurse. Option C. Walk the client to the nurse's station. Option D. Wait to see if it resolves. The correct answer is option B. Have the client lie down and call the nurse. Chest pain requires immediate medical evaluation. Have the client lie down and call the nurse immediately. CNAs do not administer aspirin. Walking may worsen the condition. Waiting could be dangerous. Question 2. Which position is best for taking a rectal temperature? Option A. Fowler's position. Option B. Dorsal recumbent. Option C. Sims position. Option D. Supine position. The correct answer is option C. Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 3. A client who is anxious and pacing should be: Option A. Placed in a chair and restrained. Option B. Encouraged to talk about what is bothering them. Option C. Given a sedative. Option D. Ignored until they calm down. The correct answer is option B. Encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 4. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A. Tachypnea. Option B. Bradypnea. Option C. Normal breathing. Option D. Hyperventilation. The correct answer is option B. Bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 5. Restorative care focuses on: Option A. Curing the disease. Option B. Maintaining and improving function. Option C. Providing end-of-life care. Option D. Replacing the client's abilities. The correct answer is option B. Maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 6. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A. Change the subject to something more positive. Option B. Tell the client to stop crying. Option C. Sit with the client and allow them to express their feelings. Option D. Leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 7. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 8. When applying gloves, the nurse aide should: Option A. Wear gloves that fit loosely. Option B. Pull gloves over the cuffs of the gown. Option C. Wear gloves only for blood exposure. Option D. Reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 9. What is the correct way to transfer a client from bed to chair? Option A. Pull the client by their arms. Option B. Use a transfer belt and proper body mechanics. Option C. Lift the client under the armpits. Option D. Have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 10. A client's oxygen saturation reading on the pulse oximeter is 95%. This is option A, below normal. Option B, normal. Option C, above normal. Option D, requires immediate reporting. The correct answer is option B, normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 11. What is the proper ratio of bleach to water for disinfecting surfaces? Option A, 1:1. Option B, 1:10. Option C, 1:100. Option D, 10:1. The correct answer is option B, 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 12. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: Option A, document it and turn the client. Option B, massage the area to increase circulation. Option C, apply heat to the area. Option D, leave it alone. The correct answer is option A, document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 13. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B, prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 14. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D, rush the client to leave. The correct answer is option A, assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 15. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 16. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B, place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 17. The nurse aide's responsibility with advance directives includes: Option A, helping the client complete advance directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advance directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advance directives and inform the nurse of any issues. The aide does not assist in completing advance directives, make decisions for the client, or explain legal documents to the family. Question 18. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 19. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 20. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C, report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 21. When receiving a report at shift change, the nurse aide should: Option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A, ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 22. The pulse deficit refers to the difference between: Option A, apical and radial pulses. Option B, systolic and diastolic pressure. Option C, radial and carotid pulses. Option D, brachial and femoral pulses. The correct answer is option A, apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 23. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 24. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath-holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 25. The nurse aide should speak to a client who is hearing impaired by option A, speaking very loudly, option B, speaking slowly and clearly while facing the client, option C, writing everything down, option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical.